Can 6 minutes of exercise put the brakes on Alzheimer's?
Well, there was a study, and we're going to give you some answers.
Well, I think this was a very interesting study that keyed in on one particular biochemical compound, BDNF. You're a biochemist. Why don't you tell us what that stands for?
I'm on the spot. Brain-Derived Neurotrophic Factor.
And it's very important with the growth of neurons. A lot of people think that neurons and nerve cells and brain cells don't grow, but they can. And that's part of the whole neuroplasticity, where brains evolve, they learn, and help with memory, get all these cells changing, and that is very important, and that's what BDNF helps do.
So in the study, they looked at different forms of exercise and how the BDNF level changed in the blood of people exercising.
With the whole theory that increased levels of BDNF would help the brain and be able to maybe even reverse neurodegenerative problems like Parkinson's disease and Alzheimer's disease, maybe even multiple sclerosis. So what did they find?
They found that the more intense exercise that folks had, the higher their BDNF.
So that sounds like a good thing. Will it reverse Alzheimer's?
I think that's a good question.
I think it's too early to tell, but we don't know what kind of levels we need to be able to heal our brains, and we don't know that BDNF is the sole solution to this. But I think it's a good start, and I think these exercises are very good because not only can they help increase levels of BDNF, but they can help prevent cancer and help the heart and prevent diabetes and all these other things.
So in the studies, what type of exercises were best to raise BDNF?
I think short, intense.
Yeah. I think
exercises.
in particular they were looking at bicycling activities. And so it's not that they would get on the bicycle for 90 minutes. Actually, they did, but it did not produce the higher levels that we see with the much shorter intensive exercises, those total of the 6 minutes where they would go for 60 seconds, maybe back off on it, then go for another 60 seconds at full intensity and back on it, off of it, and then do that for a full 6 minutes total. And that's where you really got the high levels, 5 to 6 times levels over the 90-minute kind of laid-back exercise activity that a lot of people do.
So lots of benefits to exercise. If you're looking for something else that motivates you to get on that bike and it helps you to think of your BDNF level as you're doing these things, I think it's a good motivating factor to use.
Tell us about your bicycling. Do you do it for your BDNF?
I don't do it for my BDNF, but I might now. I like to bike so that I can eat donuts. That is the truth.
I've seen him. It is the truth. A lot of people, I think they hear, I need to exercise, and they say, okay, I need to exercise for 30 to 60 minutes every day of the week for 150 to more minutes per week. But here we have some studies showing clear advantages and benefits of doing shorter, high-intensity exercises. So I think that's really something to consider.
And I think whenever you start an exercise program, make sure you check with your doctor, particularly if you have a lot of medical issues. Exercise is great, but we don't want to make sure that you don't push it too hard early on and make sure that you're healthy enough to do some of these intense exercises. Go slow initially to make sure that you don't get hurt. Biking is pretty safe. Running may have a little more impact and put you at risk of having some overuse injuries.
I do enjoy riding a bicycle, and my neighborhood that I ride in has lots of hills, so I am getting the high intensity and the low intensity, cycling back and forth like that. And I think I feel my BDNF levels rising. Not really.
Lots of ways to get good cycling in. There's a lot of interesting tools that you can get from your local bike store, little trainers and things.
Just to be clear, do you use training wheels on your
I do
bicycle?
not use training wheels as a trainer. There's a difference.
Okay, just making sure.
Get a remote control fan, get a cheap TV with some Netflix on it, and you're good to go.
When you're watching Netflix or some other program while you're exercising, because I can't do this, what types of programs do you prefer to watch?
Something that scares me to death.
Okay, so like the horror realm or just like
It doesn't even take that much.
psychological warfare type things?
I like psychological warfare.
Okay.
I like medieval violence.
Besides physical health, aren't there some good mental health benefits from these types of high-intensity exercises?
Yeah, there's an article that we were also looking at this week And I think it's a relief for those who don't like intense workouts because this was just 10 minutes a day for most days of the week. It showed immediate benefits, unlike having to wait to see if you get Alzheimer's or not. You get immediate benefit with your stress, anxiety, and it just took 10 minutes of regular exercise 5 days a week.
Back before COVID, I would go to the gym, but I noticed the days that I did that and I would come to the office and work, things happened that otherwise would make me anxious, like maybe the computers were down or something like that. I found that myself, I approached those kind of anxious times a lot easier, and it helped me, and I don't have a lot of anxiety. So I can imagine those with generalized anxiety disorder or some other problem, it would help them even more.
And I think one of the things we're trying to emphasize here is little amounts count, and it doesn't have to be intense. The more you're able to do, of course, I think the better results that you'll reap from doing these things. But even, if you can carve out 10 or 15 minutes even to do something that's not something that you're going to dread doing, going for a walk, going for a little bike ride, these things can reap benefits immediately.
I agree. I think that a lot of our patients say, I don't have time to exercise, but I think everybody can squeeze in 10 minutes to do a little something.
What should the first steps be to become more active?
I think carving out the time. And so what I usually tell people is if you'll just take 15 minutes and reserve that each day for a little exercise.
I like that a lot. The other thing I would add to it is maybe exercise with a buddy. That way you hold each other accountable.
For people who are genetically predisposed to cancer, Alzheimer's, or something, do you think exercise would be beneficial?
Oh, yes. I definitely think that exercise can be beneficial, whether your genetics put you at risk for something or not. I think it's important to realize, too, that just because you're genetically at risk for something doesn't mean you're going to have it. So if you have a gene that makes you more susceptible to Alzheimer's, heart disease, that just means you need to work extra hard to try to prevent it, because that does not mean you're going to develop those conditions.
And we're just touching on a few of the benefits that have been shown to be from exercise. So even if you didn't reap the benefits from dementia, there are plenty of others. I mean, I've heard it results in weight loss. That's a big one.
Heart disease, cancer, diabetes. It works.
Lots of benefit.
What about people who aren't really getting formal exercise?
Me personally, I like to do some work in the yard, garden, and take care of my lawn and trees and shrubbery and fruits and vegetables and things like that. And I find that gives me some very good exercise.
I do like to go for walks. And when it's pretty outside, I like to just go out and go for a walk and enjoy the outdoors. And sometimes it's just nice to get some fresh air and get out of the house and see a little bit different environment.
So the bottom line is we need to exercise to be able to treat our bodies optimally and get the most out of them. And it doesn't have to be 30 to 60 minutes a day. It can be as simple as 6 to 10 minutes if you're doing the right thing.
Carve out that 10 or 15 minutes. Get started today.
Get started today.
And don't stop.
Thank you for watching, and I hope you tune in next time to see what we have to offer.
Send your donuts to the address down below.
List in the comments your favorite donut.